Hi, I'm Liza Berger with McNice Long-Term Care News. I'm sitting here with Iara Woody, who is Health Policy Associate with AAHSA. Iara, you are an expert with MDS, and providers have been experiencing problems with the transmission reports, and CMS has had problems with coding. To what extent has that problem been fixed, and how has it affected providers?
Well, a lot of providers actually had sent the MDS reports through, and apparently the program that CMS had was calculating the payment wrong. So CMS discovered that later in the month, and around the 21st, they came out with an announcement asking providers to resubmit everything that they had submitted, and they would get new validation reports, revised validation reports that they could use. Once that was resolved, then they started getting the validation reports, but then we had vendor issues that that weren't matching, weren't reconciling with CMS. So now we have another issue of these validation reports actually going through to CMS through the software. Our members are experiencing some frustration with that, but we're working through it, and we're now at the end of the month, and we're hearing that now they are submitting reports just fine. There are some issues with software vendors still, but apparently CMS is working with them to resolve them.
Okay, so if you could offer any kind of advice or suggestion for providers of what they should be doing sort of in the interim as this is still being worked out.
Well, they should continue to be contacting their vendors and CMS. Apparently the vendors are working with CMS at this time, but if they're still having issues with the software, they should definitely contact the vendors directly.
Okay, thank you so much.
Thank you.